Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics in Williamsburg, Virginia. I like to see kids by age 8 because there's some interesting interventions that you can do when you catch kids young, and you can do some great work. And so this is a perfect example of a phase 1 case. We saw Chase when he was 8 years old. His mom is actually works in a dental office here in town and brought him to me for evaluation. And a couple of things to note. So this is Chase when he started, and you'll notice that there's some spaces in those upper front teeth, and you'll see a little bit more about that in just a second. So here's Chase's bite up close. You'll notice if you look way in the back, this is his back right. The upper teeth are to the inside of the lower teeth. We call this a posterior crossbite, and it's not like that on the other side. His upper teeth are to the outside of the lower teeth. But one of the things that happens in these situations when it looks like one side of the bite is right and one side of the bite is not, typically what happens is that the child is actually shifting their bite to one side so that one side looks correct and the other side looks incorrect. If they didn't shift their bite, actually both sides would be incorrect. And so the body thinks it's better to have one side correct and one side incorrect than both of them not right. So they'll habitually shift their jaw to one side. So we call that a posterior crossbite with a functional shift, and that means that they're shifting their jaws. The reason why you want to fix these early is because if somebody's habitually shifting their jaw to one side over and over and over again, they actually begin to grow their lower jaw to be bigger on one side than it is on the other. So they actually grow an asymmetric mandible or lower jaw as a result of that functional shift. That asymmetry of the mandible causes a whole host of other issues, including TMJ problems. And so we like to intervene on these early. Now, in addition to that posterior crossbite with a functional shift, this is a picture of Chase's upper teeth. And he, if you look over here, this is his left side. There are 3 baby teeth here, 1, 2, 3. And if you look at the right side, there's only 2 baby teeth, 1, 2. He lost this other baby tooth prematurely. It was knocked out when this adult tooth came in. And the problem with that is that baby teeth maintain space for adult teeth to come in later. And so with this adult tooth coming in and knocking out that baby tooth, it has invaded the space where another adult tooth eventually belongs. And so this is going to create a situation that prevents some of the adult teeth from coming into the mouth properly. So this again is another thing that warrants earlier phase 1 treatment. So we've got the posterior crossbite with a functional shift, something we definitely want to fix early, because if we can fix that early, then his growth, the growth of Chase's jaws can normalize. And we also want to fix this crowding situation early, because this will affect the ability of permanent teeth to make their way into the mouth safely later on. The same thing happened on Chase's lower arch. If you look over the left side of your screen, but this is actually his right side, you'll notice 1, 2, 3 baby teeth. And if you look at the the right side of your screen, which is the left side of Chase's mouth, only 1, 2 baby teeth. Again, this adult tooth came in a little bit too far to the left. It knocked out the baby tooth that corresponds to this one. And so now we have a whole baby tooth that's missing on this left side, and that baby tooth is useful because it helps maintain the space for the adult tooth below it to come into the mouth. Now, on the bottom, we could do some treatments to alter this. But one of the really interesting things about lower teeth is that these 2 remaining baby teeth on the left side and these 2 baby teeth on the right side, they are bigger than the adult teeth that come in after them. So there's actually going to be space for everything here. You just have to maintain that space. So we placed a retainer. We call this a lingual arch. In layman's terms, I just call it a retainer. And the idea behind this retainer is that it's going to hold all of the space from the adult tooth in the back all the way around to the adult tooth on the back side on the other side. And as we lose these baby teeth, we will gain space. Eventually, we'll have to shift things around in the front of the mouth a little bit, but we will gain the space to make sure that everything has room to come in here. On the upper arch, we are not that fortunate. We actually did need to put, we actually used a palate expander. So a palate expander made his upper jaw bigger in a side-to-side way. That's what takes care of the posterior crossbite with the functional shift. And then we added some braces to the front teeth and pushed the front teeth together. We recreated space up here in his upper right-hand side where the space was lost earlier. So What does that look like? Here's an idea of the center teeth, and you can see in the back, the upper teeth are now to the outside of the lower teeth, so we have the posterior crossbite corrected. He's no longer shifting his jaw every time that he bites down. Here's Chase at the finish, and you can see we've got this nice smile. The middle of his two front teeth is lined up with the rest of his face. All the gaps are closed. All right, so here's a comparison of the lower teeth. We have, of course, the crowding that existed right here, and we are choosing not to resolve that crowding right now. Instead, we're going to hold all of the space from one side all the way to the other. We will gain space as we lose these really big baby teeth, and as the adult teeth come in behind them are actually smaller in size, so we're going to gain space, and we'll be able to fix that in the future in a second phase of treatment. Here's the upper arch comparison, and you can see that on his right side, which is on the left side of the screen, we recreated a lot of the space up here. So this baby tooth was lost right at the end of treatment, but we recreated a whole lot of space between that baby tooth and the 4 adult front teeth. And you can really appreciate also that the arch is bigger because of the palate expander. Here's a comparison. Again, if you look in the back here, you'll notice that the upper teeth are to the inside of the lower teeth, and now I've got all the upper teeth to the outside of the lower teeth. And then once again, just a really nice change, a little bit more aesthetic smile. We were not in this treatment to give Chase a nicer smile, but it's a nice byproduct of what we're able to do with everything else. Our big purposes were correcting the posterior crossbite, correcting the functional shift, and recreating some of the space for those upper teeth where the space was lost prematurely. So this is a great phase 1 treatment. Thanks to Chase's mom for bringing him in, and we're so glad we were able to address all these things early. We will wait a couple of years. We'll wait for all the baby teeth to come out, and we'll wait for all the adult teeth to be in when we begin our second phase of treatment. And our second phase of treatment will be really geared towards making sure that his bite fits together well, and that he's got a really perfect smile. All right, thanks for listening. If you have any questions about phase 1 or early treatment, please give us a call or let us know. Thanks so much.